an event which celebrates European Depression Day and marks the launch of very important recommendations.
We mark the 10th anniversary of the European Depression Day. If you briefly remember, it was launched in 2003, and the aim was at that time to put like a focus on depression as a serious and life-threatening condition affecting more than 30 million people in Europe. I believe everyone can understand just from the number at that time how important the issue actually is.
In order to achieve an EU policy and to be able to debate and and formulate policy, we are launching a paper here today which has been drafted by leading experts on depression on the workplace and have been offered the support of representatives of very key stakeholders from the field of health and employment. The expert recommendations that we will be looking at today are aimed specifically at providing input as to how to support employers and employees in European workplaces by introducing measures to tackle depression in employment policies at EU and national level.
It's not just the sufferer who needs educating. I think it's absolutely vital that we have a blanket approach to society's awareness on the issue. Because when you have a sufferer, it's incredibly hard for that person to step forward and receive the help and support that they need. So although, let's say, 1 in 4 people are supposed to suffer mental illnesses, mental health issues in England, there are 3 in 4 people who are looking from the outside in, who, if they were educated on the issue, if they understood what the signs and symptoms were, they could hopefully be free to actually acknowledge it in the other.
Policy can't just rest within the country because there's so many competing interests around economy and what governments want to spend money on, dependent on their knowledge of the impact it will make on their citizens. But at European level, we can take a long, cold look at this situation and go, if we create policy that all the countries have to implement, then it will be done. Funding will be assigned. And I work on the front line, I work in services, and I know that there is no money at the moment for initiatives that look at depression in the workplace. There's no incentive for employers to address this issue because they're not aware that how it impacts on their bottom line, and there's no one telling them they have to do it. So it's hugely important that policy addresses this.
From 2008, the suicide rate has increased again. So as a consequence of the crisis, or perhaps of the management of the crisis, we are having now new problems to deal with. And my idea is that it has been possible to improve things tremendously in the mental health field and in the prevention and treatment of depression.
I think important is that we have to consider the consequences of work conditions already if we plan workplaces. We have to estimate the consequences of our planned working conditions. And we have tools, for example, simulation tools, which give us hints in which way you can alter the planned working conditions to avoid negative consequences.
The workplace is a real good chance, on one hand, to prevent lots of depressions, and on the other side, to identify the people with depressions and to bring direct support to them. It's not the role of the executives to manage the support, but to offer the support. This is a real big chance at the workplace to bring them to networks, to psychiatrists, to psychotherapists, and to show that the company gives you the full support at every stage of the illness and before to prevent the illness, because we need the employees at the workplace.
We really do need to make sure that that new strategy, to be adopted quite soon, addresses psychosocial risks at work, but in particular workplace depression. The work is far from done. We'll be watching that strategy when it appears and making sure that now in our parliamentary work we make sure that workplace depression features prominently in that future strategy. We need to make sure that from 2014 onward in the new mandate, this is one of our highest priorities. We really do need to tackle this scourge.